All right, folks. Today I'm diving into an important topic, heart murmurs and valve issues. Let's break it down in a way that's easy to understand. First, what exactly is a heart murmur? It's an abnormal sound. Think of it like a whooshing or swishing noise that you can hear during a heartbeat. This sound is caused by turbulent blood flow in the heart or its valves. Now, murmurs can be innocent, meaning they're harmless, or pathologic, which means they're caused by heart disease. So let's talk about the aortic valve. This valve controls blood flow from the left ventricle to the aorta. There are two main problems you might encounter here: aortic stenosis and aortic regurgitation. Aortic stenosis is the narrowing of the valve. It can be caused by age-related calcification, a congenital bicuspid aortic valve, or rheumatic heart disease. If you have it, you might experience chest pain, shortness of breath, fainting, or fatigue. The murmur sound here is a harsh systolic murmur, best heard at the right upper chest. Aortic regurgitation, on the other hand, is when the valve is leaky. This can be due to valve degeneration, infections, or connective tissue disorders. Symptoms include fatigue, palpitations, shortness of breath, and a wide pulse pressure. The murmur sound for this one is a high-pitched diastolic murmur, best heard at the left lower chest. Now, let's switch gears to the mitral valve, which controls blood flow between the left atrium and the left ventricle. One common issue here is mitral stenosis, or the narrowing of the valve. Causes can include rheumatic heart disease and congenital defects. Symptoms: shortness of breath and fatigue are big ones. All right, that's a quick overview of heart murmurs and valve issues. Keeping your heart healthy is key, so if you experience any of these symptoms, make sure to consult a healthcare professional. Thanks for watching. Stay healthy and take care.